Welcome, my name is Fong. I'm the founder of ScolioCare Corporation. We're the exclusive distributors of SpineCor for Philippines. Now, SpineCor is designed to preserve normal body movement. So it is not unusual to see someone wearing SpineCor doing gymnastics, ballet, playing football, baseball. So on the internet, you'll see countless of children wearing it for all different kinds of sports. Of course, you can wear it for swimming. Now, SpineCor is designed for pediatrics and adults, like we mentioned. In the case of children, it really depends on what stage of growth they're at. So if they're at the stage where they're pre-pubescent, so they haven't hit puberty yet, then the chances of correcting the spine is much higher. But unfortunately, once they enter puberty, you are now fighting against time and you're fighting against their body's growth. So during that period or that stage, our main objective is to try and either stabilize the scoliosis or to provide some sort of a support, or in this case here, slow down the progressiveness. But unfortunately, there will be some cases where the scoliosis can progress quite aggressively despite any kind of treatment. So whether the child is having a hard brace or soft brace, for those cases, unfortunately, surgery may be the most viable option. So SpineCor is not a substitute for surgery. There will be quite a number of patients who have scoliosis, and unfortunately, surgery is the only option. Okay, but however, for the majority of other patients who do not require surgery, there are many different options available. Now, traditionally in the past, if you have scoliosis, you'll be categorized into two different categories. So if your curve is more than 40 degrees, you're classified as having a scoliosis that is a surgical category, so you are a possible candidate for surgery. If it's below 40 degrees, then you are classified as a non-surgical candidate. However, there are exceptions to the rule. Now, in most cases, if you are classified as being a non-surgical candidate, so the general method is to observe and monitor, or you'll be asked to undergo rehabilitation. So in some cases, that can be physiotherapy, chiropractic, osteopathy, or even exercise therapy. And the last one is bracing. Now, over the years, studies have shown that there are many different types of bracing. So the question is, when you're being braced, what type of scoliosis are you being braced for? And what is the main objective of the brace? Now, traditionally, the braces were designed to maintain what we call three-point pressure. So if you're hunching, the aim of the brace is to straighten it. If you rotate it to the left, then its aim is to rotate you back to the right. Or if you tilt it, it will try and push you back. So over the years, a lot of the hard brace techniques are designed to target these 3 points. And studies have shown that it is not that effective. So for many years, the idea behind it is, if you take a spine and you straighten it, then removing the pressure of the compressed area will encourage bone growth. And studies have shown that static distraction does not change the scoliosis. So what is required is that bone on the side of the compression has to undergo distraction, so stretch, compression, and this has to be repeated over hundreds or thousands of times during the day. So this stimulates activation of bone growth, and SpineCor does allow that. It allows mobility, it allows normal movement, it allows stretch, compression, activation of muscles. It provides resistance against muscles, strengthening the spine. Now, when it comes to children, as we mentioned, the scoliosis is targeted to either correcting, stabilizing, or supporting the scoliosis. In adults, the objective of scoliosis is completely different. In adults, the main objective is pain management. So we usually call it the 3 Ps. So the first is pain management, and secondly, to maintain stability to stop it from progressing. And the third one is to provide postural or structural integrity. So when it comes to bracing, no matter whether you're using hard brace or soft brace, even SpineCor, it was never designed to reverse the scoliosis. However, in most cases when patients are being braced, it is not unusual to see changes or improvement in the spine. And if that does happen, that is an absolute bonus. Okay? And studies have actually shown that SpineCor, when compared to all the other types of braces, in 2007, this was published in the Journal of Pediatric Orthopedics. In 2007, they found that SpineCor was not only 3.9 times more effective than the hard brace, it was 3.7 times more successful in stopping some of the cases from progressing into surgery. Now, SpineCor has been used in over 70 different countries, and over tens of thousands of patients have been braced. It has been shown to be clinically effective in over 89% of cases, and this was tested on over 400 patients over a 10-year period. Now, in the case of adult scoliosis has been, within its first 2 years of development, it has been tested on over 200 patients, and within 6 weeks of wearing it, most patients have noticed reduction in pain. So, once again, in terms of bracing, whether you are suitable for bracing, please inquire with ScolioCare, and we will see what we can do. And please do not hesitate to contact us if you have any questions. Thank you.